Hello, and welcome back to the Holistically Well podcast. I honestly cannot believe we are already here. This third trimester with baby number 4 has flown by. And when you are listening to this, I am less than 10 days from my due date. So I am recording ahead. So when you are listening to this, I don't know if I've had the baby yet or not. We'll see. This is crazy. But I am well into my third trimester at this point. If you are watching the video, you'll see the sunlight is just streaming in on me right now as we are transitioning into winter time. But it's a bright, sunshiny day, which is such a relief from the gray weather here in Ohio in December. So with 3 little ones and my 4th on the way, this has definitely been the fullest season of life, walking through pregnancy. As you know, I also run my own private practice and am keeping the Holistically Well podcast alive and my Holistically Well preconception, pregnancy, and postpartum programs. We are also in the process of building our dream home. So life has been full, but in the best of ways. And I love having the time each trimester to just pause and reflect on what's working, what I chose to do differently in this pregnancy compared to others, because each pregnancy has brought its own set of challenges, but also of new knowledge, of new information. Working in a field of women's health, I get to apply what I learn professionally, not only to my patients, but also to myself. And it brings me such joy to bring that knowledge, that education, that empowerment to you. So whether you are currently walking through your 3rd trimester of pregnancy as well, or if you're dreaming of a future pregnancy, I hope that this conversation helps you feel empowered and at peace with your body right where you are, as well as gives you the tools to feel like you're doing everything you can to support your body in this sacred life season. So the first area we're going to cover is why movement still matters in the 3rd trimester of pregnancy. Now, I am a doctor of physical therapy and orthopedic and pelvic floor specialist. I'm also a prenatal and postpartum corrective exercise specialist. So you bet that movement is super important to me. This is my prescription pad. I don't prescribe medications. I do chat with clients about supplements. But movement is medicine, and it is my prescription pad for patients and for myself. So the 3rd trimester does feel different, right? The belly is heavier. It is lower. We a lot of times can have breast tenderness and more breast fullness as well, which can affect our posture and back or neck discomfort. And that's why movement, honestly, is more beneficial and necessary than ever, because it can actually help alleviate those aches and pains. So many women think about just turning to passive interventions such as chiropractic care or massage therapy to help alleviate those aches and pains. And while those things can be great and a nice adjunct to care, they cannot be the end all be all. If you are solely relying on adjustments every single week or adjustments multiple times every week or getting every other week massages, while that can feel great, you're really not doing anything to change the game of why you keep feeling tight or heavy or uncomfortable. We need active movement to support your muscles and to support your fascia and to support your growing body and baby. All right. So movement is so beneficial. It is going to increase circulation. It's going to help boost your mood, so your mental health. It will help optimize baby's positioning and give you sustainable carryover to, again, not just rely on somebody else to do that for you. And this is where I feel like we really differ when it comes to pelvic floor physical therapy, because not only within visits, am I helping patients get into alignment and reduce areas of tension with manual therapy, which is, quote, the passive side of things, but we're also tapping into the active interventions, and I'm giving all of my clients exercises for home so that they can do things actively to support the body. So it really is that we need both pieces of the puzzle. It can't just be an either or. At this time in pregnancy, in the 3rd trimester, we do get to shift our focus from gentle strengthening routines to more alignment and mobility focus with that upcoming due date, right? With that upcoming labor and delivery. And so something I like to incorporate starting at the beginning of the third trimester, ideally, and if not at the beginning, then whenever you are listening to this, make sure that you start incorporating it now, would be the forward leaning inversion. Now, this is an exercise created by spitting babies, and it helps relieve ligament tension, specifically in the lower round ligaments that attach that uterus down to your pelvis. And this also will then help with baby's positioning. So a forward-leaning inversion, I'm going to kind of chat you through it. If you're having trouble visualizing what I am saying, then go to the show notes and click on my blog post, because there'll be a picture of me doing this exercise there. You can also Google forward-leaning inversion by spinning babies, and you'll see their information directly from their website there. But I do break it down in the blog post. So you will get on a couch and you are going to walk your forearms down to the floor and place your head between your elbows. And so you have no pressure through your head. Your forearms are positioned on the floor and you are completely inverted. You're like making a V position with your body. Your buttocks is high in the air. You are kneeling on your knees and your forearms and head are down on the floor. You are going to pause there and do diaphragmatic, nice deep breaths for 30 to 45 seconds. Now, instead of setting a timer, I like to count my breaths. So at rest, sit with your phone or stopwatch and time how long it takes you to do 3 to 5 deep breaths. For me, that's anywhere from 30 to 45 seconds, right? So I know that if I do 3 deep diaphragmatic breaths in an inversion, I just did that for about 30 seconds. Same with about 15 seconds for 5 breaths, right? So that is a way to tap into calming your nervous system, in addition to lengthening those round ligaments, reducing any of that like crotch pain or lightning crotch discomfort that some women experience around this time. And it helps with baby coming head down for their positioning, because we've just created space lower in the womb by inverting gravity for a period of time. Now, when you come out of that forward-leaning inversion, you do want to pause in a kneeling position. That kneeling position is a time where if that baby was in a breech position where their buttocks is down, that they may make that big flip to be head down. So it is important to pause for a minute in that kneeling position on your couch or your chair. These adjustments are broken down further in the Holistically Well pregnancy program as well. So just keep that in mind if you want further clarification in terms of how to do them. But I suggest anywhere from 1 to 3 times daily, proactively throughout the third trimester. And if you, after 32 weeks, notice that your baby is still not head down, then we want to up the intensity or the duration or the frequency of these to 7 times daily for, around that 45-second range, as well as a myriad of other things, okay? Now, some personal insight in terms of how my body's feeling in this third trimester of my 4th pregnancy is that I have definitely experienced more SI joint tightness, so sacroiliac joint tightness, specifically in my right hip. And I honestly think that is because I have a now 22-month-old. So I still have a little toddler, and with each of my other pregnancies, our kiddos were spaced about 6 months further than what this baby is with my youngest. And that is a big difference, having a not yet 2-year-old, as I am getting very close to delivering my 4th baby. I'm holding him a lot more. I'm getting up with him through the night sometimes. He started to have bad dreams recently, so I'm sleeping in funky positions with him cuddled up next to me. And so I definitely think that that has played a role in why my alignment has been off in my pelvis more, right? That makes sense. So I have had to be a lot more in tune with doing movement that's going to help support me and support my alignment. And so I think this is an important thing to bring up, because it's a reminder that even physical therapists need support. And so it's not a sign of weakness. It's not a sign that you're doing something wrong if you are noticing pain and discomfort, but it is a sign that you need to listen to your body and do something about it. All right. So, how have I modified my workouts or my mindset this time? Well, my workouts have been modified to include more double leg work. So, anytime we have SI joint discomfort, so that's pain in the back portion of the pelvis, things like lunges, single leg RDLs, single leg squats, jogging, step ups, one-legged activities in a weight-bearing position can cause that area to flare or cause that discomfort to flare. And so I have definitely incorporated more double leg squats, more 80-20 squats, so I'm not completely single leg, a staggered stance deadlift versus full single leg deadlift, because that is what is going to help maintain stability and alignment in my pelvis. So this comes back to my point of not simply relying on chiropractic adjustments to get you through, because if you're out of alignment every time you go in, you're not addressing the root cause, right? There's a reason you keep going out of alignment, and you need changes in your activity or movement patterns to help you maintain alignment and stability. That will then keep you out of pain, okay? So I have seen our in-office PT. I do have 2 other PTs on staff here, and I've been able to see them when I feel out of alignment if I'm not able to self-correct from home. And it's really hard to check your own alignment. So having somebody else's eyes on you can tell you exactly which way you're rotated and help provide some of those passive treatments to help ease tension, but then learn what active treatments you can do at home, what active movements you can do at home in terms of like an exercise routine to help keep you in alignment, to help keep that joint stable. And I bring this up as well because in the 3rd trimester especially, we have that hormone relaxin coursing through our body. Our pelvis is meant to move. Our sacroiliac joint, the SI joint, is meant to move. That joint has really 3 parts and is meant to expand to allow baby through the birth canal. So it is a good thing that that joint wants to be mobile. However, we don't want to be in pain, right? So it's finding this right balance of exercising and supporting the body so that we can stay out of pain while also honoring that innate mobility of the joint that it needs to have for a vaginal birth and delivery, okay? So that is how I really marry those 2 areas in terms of active movement and then passive support from a manual therapy, but also active movement standpoint, and why I think a pelvic floor physical therapist should be part of every woman's pregnancy journey, especially in the 3rd trimester. So if you haven't found one yet local to you, be sure to reach out. We treat patients in the Sydney, Ohio area and virtually. So if you don't have a PT of ease of access to you, then reach out and our team would be happy to support you virtually. So what does a weekly movement routine look like for me as a holistic orthopedic and pelvic floor physical therapist in the 3rd trimester of pregnancy? I thought it would be helpful to give you just like a weekly rundown as what does this actually look like in real time. So on Mondays, I'm typically focusing on core and pelvic floor work. So we need to continually support the core. By the end of the 3rd trimester of pregnancy, nearly 100% of women have a diastasis recti. This is okay. This is creating space for baby to grow within our belly, but it is that abdominal separation. So if you are further in pregnancy and you're laying on the couch and you go to sit up and you notice like this coning in your belly and you're wondering what that is, it's a diastasis recti. It is completely normal for women to have this, especially in the 3rd trimester of pregnancy, to make room for baby. But we want to manage and reduce the severity of it so that it is easier to heal postpartum, because if it doesn't heal, that can lead to back pain, more SI joint pain, all of that. So I am doing a core series from my Holistically Well pregnancy program. I mix it up. I'll do our frontal core work or some oblique work and deep core work. I really cycle through those 3 different categories, and they are about 10 to 15 minute movement routines. If I only have time to go through it once, I will just do it once. If I have more time, then I'm doing 2 rounds of that circuit, which would bring me to about 20 to 30 minutes. And usually I'm doing this during nap time because I am home with my kids on Mondays. On Tuesdays, I I'm doing a lot of brisk walking broken up throughout the day. So in past pregnancies, I did continue to jog like all the way through pregnancy, more walk jog. This pregnancy, I still do. I definitely still jog, but especially with the timing of this pregnancy being, into December now in Ohio, I'm doing more just brisk, shorter walks, like walking my daughter to and from school, walking my son to and from school. Each one is a few blocks. And then I'm making sure I'm getting upwards of 10,000 steps a day. And this is on pretty much all days. But on Tuesday, it is more of like a focused, making sure I'm getting in a little bit more cardio intensity, I guess you could say, where my heart rate's getting up more. Some days this looks like jogging. If my SI joint is acting up, then it's simply walking. Okay. And then Wednesdays, this is for Pilates strengthening exercises. I do these mat focused on the hip and the glutes, specifically on the deep hip rotators, especially internal rotation at this point in the third trimester, which helps us lengthen the pelvic floor. I have a movement routine for this in my Holistically Well pregnancy program as well. And it is awesome to just press play on that again during nap time because Wednesdays I'm home with my kids. On Thursday, I am in the office and I typically begin my morning before I even leave home with a mobility flow and a walk. So this day, I focus a lot on thoracic mobility whenever we hold a lot of spinal tension, which especially as the breasts kind of increase in size at this point in pregnancy, that impacts tension in the pelvic floor because of fascial connections from our jawline all the way down our spine into the pelvic floor. So really working on thoracic mobility, hip mobility, spinal mobility, even deep neck mobility here and jaw relaxation is my focus on Thursdays. Fridays, I tune back into the core and the pelvic floor. So circling back to what I was doing on Monday, I had mentioned a few different exercise flows that are within my Holistically Well pregnancy program that I cycle through. That is what I am doing on Friday as well. So I'll choose one that I did not do on Monday. And there's a lot of breath work focused there, which is really, really helpful for relaxing the pelvic floor as well. Saturday is really a family day. So that to us looks like maybe doing a family hike or going out to the park or just simply like dancing and being active, playing and crawling around with the kids. Just simply seeing movement as joy and not feeling like, oh, I have to set this time aside to do this specific movement. It's more so just going with the flow. If we want to go up to our local community center and just run around at the gym and play basketball together or tag, those types of things. So just intentional movement as a family. Now, the reason that is extra important is that joy brings on oxytocin, and especially in this third trimester, oxytocin is vital for triggering labor. And so every week, making sure you have a day like this where just the sole focus is joy, is oxytocin, is just doing what you love. And if we look at these different activities that I mentioned, it's a lot of varied movement patterns. So dancing with your kids, just being silly, that's great for releasing glute tension and pelvic floor tension and hips, okay? And then playing on the floor with your kids, if you have other young children like me, literally crawling around and acting like you're different animals or playing house, things like that are awesome for baby's positioning because anytime we're on our hands and our knees, it's going to help facilitate baby to be what is not sunny side up. So sunny side up is when baby is head down, but they're essentially facing the wrong way. They're looking away from the back of our pelvis. So like their head is facing forward versus being in the optimal position where we want them looking at our sacrum. So the back of their head would be towards the front of our body. And when you're on all fours, it helps baby rotate into that position. And so that's where like just playing, doing silly play with them on the floor is actually also helping baby's position. And then Sunday, this is a day to totally tune into rest, recovery, and myofascial release. This is when I'm grabbing my foam roller, my myofascial release balls, and I'm doing like an at-home Holistically Well spa day. I am dry brushing. I am doing my gua sha to help ease any kind of neck and jaw tension, because again, that all correlates with pelvic floor tension. So just totally a reset day. We have myofascial release balls in office that are smaller than a tennis ball or a lacrosse ball, and they just really help get into those smaller muscles of your pelvis and your hips. So if you're local, reach out. I'm happy to get you one of those. And then foam roller extension, fantastic for, again, releasing that mid-spine tension. You can also tap into those inner thigh muscles. Just a good overall reset day. So that is what a typical week looks like. And I hope you felt that that's really doable, right? Having an established routine is so important because it gives me something to do each day, even if it's at a different time, right? If my son didn't sleep well and I'm up early in the morning, well, then in the evening, I know what I want to tap into before I then go to bed. So your day can be flexible. It doesn't have to be super rigid. And that's honestly why I wanted to create a virtual program that you can just press play on the videos whenever it works for you, because as a busy pregnant mama, each day can look really different. And you'll also notice that most of the routines were focused on just calming and grounding and not trying to do more or set a new PR, right? It's really focused on supporting your body in this special season. Moving on to nourishment of your body. Our nutrient needs peak here in the third trimester as baby is putting on more fat stores for whenever they come into this world. We want to prioritize quality protein and minerals. I think it's important to note here that our soil quality has decreased over the years, especially here in the United States. And so while I love getting a really solid whole food diet, I'm also supplementing with the Full Well prenatal. This is super clean, bioavailable, and trusted by the likes of registered dietitians who have the gold standard in terms of prenatal support. So I use and recommend Full Well prenatal. I'll put a link in the show notes where you can get 20% off your first order. And I also use their fish oil. Now, quick note on the fish oil, it's great for the nervous system development if you're not getting in seafood or like something like salmon that's high in omega-3s 3 times a week. If you are supplementing with fish oil, though, and your iron levels are low, you may want to consider stopping fish oil as it can interfere with your body's ability to absorb iron. So just a quick little tidbit for you there. I am using collagen every morning in my coffee. Collagen is literally the protein building blocks that our pelvic floor and our deep core and our fascia need as they are growing and expanding. So it's not only helping your body grow and expand and helping your skin elasticity as well, which may reduce the risk of stretch marks. It's also giving baby extra protein support, which is really helpful for blood sugar stabilization. So I just put that in my coffee every morning, which also helps mask some of the effects of like a quick blood sugar spike and then fall after having coffee. So highly recommend that. I'll put the link in the show notes for Perfect Supplements Collagen. Code Dr.Kayla will always give you 10% off of each of their products. Another favorite of theirs is the MCT oil. I use that more postpartum, but that helps up healthy fat, particularly when breastfeeding, to assist breast milk fat stores, which is great for baby. Another tidbit in terms of getting more protein into my diet would be utilizing Be Well by Kelly protein powder. I make energy balls with this. I will put it in smoothies for the kids and I, or just froth it into raw milk. And that helps get me another 25 grams of protein very simply. Discount code Dr. Kayla will give you 10% off there. Beef liver, I am taking 2 to 3 times per week. This, I like to mimic the use of beef liver in my diet. Now, this time of year, when it is winter, I am cooking more savory dishes where I'm good with just using the beef liver directly in my cooking. So if you are not using it in your cooking though, then you would consider supplementing. I also like getting this one from Perfect Supplements, so you can still use code Dr. Kayla for that one. Now, what has helped me maintain energy in this third trimester? I think it really is cutting out the noise of what's not important and really just focusing on what is. And so, focusing on those main nourishment needs and kind of letting go of the rest is really important. And letting go of stress, it can be so hard as busy moms to just make things harder than they need to be sometimes, and just come back to the root of, okay, each meal needs to have protein, it needs to have some kind of a vegetable, and there we go. Like, not overcomplicating it and not feeling like it needs to be these crazy new recipes. Just sticking to what you know and what your body responds well to, and keeping it simple. Now, hydration ties right in with our nourishment, making sure you're getting at least half your body weight in water every day. I'm also taking a daily packet of LMNT, Element. My favorite flavor is watermelon, and I am usually doing that after lunch. And so it's become just a nice little routine to add in that is helping water get to where it needs to go in my body. And so if you are pregnant, absolutely recommend making sure you're getting electrolytes in addition to water, because water alone is not going to hydrate your muscles and your tissue. And we need well-hydrated tissues to be able to expand for childbirth. So signs that you're underhydrated would be having cramps, having more fatigue, having headaches. And so if you're noticing those things, really making sure you're tapping into your hydration, and not just water alone, but also electrolytes. I will put a link in the show notes to get a free 12-pack of samples anytime you order from Element. They're an awesome company who I've really enjoyed supporting and using throughout this pregnancy and into breastfeeding postpartum. I will definitely continue that as well. So as you continue to move through third trimester, mindset is absolutely integral for preparing for birth. And so this has been another area I've really focused on, to shift from doing and go to more just being present in my body, tuning into my breath, slowing down more, nesting, really connecting with this baby, and also faith-based grounding. So prayer, a lot of breath work during prayer and meditation, and surrendering the timing of this baby to God's plan, surrendering the way this baby comes into the world to God's plan, and trusting that my body was made to do this. My body was designed to give birth. And so preparing for birth really just repeatedly comes back to presence and trust and letting go of tension, letting go of fear, and not holding on to control or perfection. And so that has been a huge part of preparing for baby number 4. Having gone through this 3 times before, I do feel like I've learned more about myself and my body each time. And so in this 4th pregnancy, bringing even more of the faith aspect, the spiritual aspect into my preparation. I feel like I've done that every labor, but hadn't as much thought about it in terms of those weeks leading up to delivery. And so that's been really special, especially with the due date of Christmas Day. I mean, my goodness, no wonder it feels more spiritually tied. I have walked this pregnancy journey in the exact same timestamps as the Virgin Mary. And for anyone else who is Catholic, gosh, just taking a moment to pause on that and reflect and like, wow, that's pretty neat. And so I think that in part is why this pregnancy has felt even more just spiritually connected. And that's been really special to reflect on and walk through. So what daily rituals really help me slow down and connect in terms of that? That would be every evening before bed, I'm reading through a Bible study, or just listening to home birth stories, or unmedicated birth stories, which bring in that spiritual aspect as well. So my friend, if you are walking through your own 3rd trimester right now, please know this: your body is wise, and trusting your intuition is truly empowering. You're already doing such beautiful work to support you and baby, and sometimes slowing down and feeling more grounded and in tune with your own intuition is exactly what your body needs to be able to lean into labor and to truly let go and relax. So if today's episode encouraged you, would you share it with another mama in this season? And if you're ready for deeper guidance, you can join me inside the Holistically Well Pregnancy, where I walk you through trimester-specific workouts, mobility flows, core and pelvic floor training, and holistic health guidance specific to each trimester of pregnancy. All of it is designed to help you feel strong, calm, and confident heading into your own birth. I will also put my third trimester specific birth prep plan. It's just the segment that's specific to the third trimester if you're finding me later in pregnancy, whereas like if you don't need the full pregnancy program. So I will also put that link in the show notes for you because the cost is lower than the full program. Now, until next time, I am cheering you on every step of this sacred season. Remember, thriving, truly thriving through pregnancy is and should be the new normal.